Facebook. It is Thursday evening. I'm Dr. Jordan Leasure. I am the owner and physician of North Shore Proactive Health, a state-of-the-art wellness clinic in the northern Chicago suburbs, and we are talking optimal blood levels this evening in our stress management boot camp. Okay, so why are we doing this tonight? I've had a lot of patients talk about not feeling amazing, but they go to their doctor and their doctor says your blood levels look okay. So that's why we're talking about this tonight. How does this relate to stress and what is going on? Obviously, if you are not feeling fantastic and your doctor tells you that it's all in your head, that's going to cause some stress. If your blood chemistry is not where it should be, then that can cause some stress. And obviously with everything that's going on with the virus, we want to make sure that you are at optimal operating capacity to fight that off. So let's get started. So we're going to talk tonight about what optimal should be. If you have your blood work printed out like I suggested, then grab a pen. And my recommendation would be just to fill in next to, each of your tests that they run is going to have a reference range listed. And reference ranges are going to vary by lab. So my recommendation would be to just grab your pen and write in what the optimals are that I recommend. And then go through after and see if your tests really do fall within the optimal range, number one. And number two, see if they do not fall in optimal, but they do fall in the reference range. So the reference range, for those of you that are not familiar with blood work, I want you to think for a minute about the stereotypical type of person that goes to the doctor. The stereotypical type of person that has blood work done. And generally speaking, that's going to be someone that's ill. It's going to be someone that is not doing well. And that's why they're running blood, to see what's wrong with them. So essentially what these reference ranges are based on is on sick individuals. They are not based on healthy individuals, and they are absolutely not based on individuals that are operating at optimal capacity. And that's what we want for you. So as I'm running through these levels, jot them down. If you have questions, of course, message me privately. We are offering really discounted rates right now because a lot of people are out of work and we want to help as many people as possible. So if you have questions on your blood work, you can email it to me. I will do a complete analysis on it for $95, send it back to you, let you know what it looks like, what it should look like, and where there may be problems that you want to start to investigate with your physician. So let's jump right in. Now, the easiest thing that most doctors run is called a CBC. That stands for complete blood count. A handful of things that are going to be on that is going to be your white blood cell count, your red blood cell count. What does hemoglobin look like? What's hematocrit? MCV, MCH, what do these mean? And again, we'll talk about this tomorrow when we dive into each test a little bit more individually. So we're looking for what cells are there, what are the sizes of the cells, what's the quantity of the cells, how many of those cells are there, are there platelets? Of course, there are platelets. What do the platelets look like? How many, and what are the health of the type of white blood cell that are there? So that's what we're looking at essentially in a CBC. So optimal ranges for white blood cells should be about 5 to 8. Red blood cells are going to be 3.9 to 4.6 in a female, and about 4.2 to 5.0 in a male. Both of those are kind of close to what the reference ranges for a lot of labs are. What you will notice is optimal ranges might be a little bit tighter. Hemoglobin is going to be 13.2 for female to 14.5, and 13.9 to 15.8 for male. Hematocrit is going to be 37 to 49 for female and 40 to 48 for male. Mean corpuscular volume, or MCV, is going to be 82 to 89.9. MCH is going to be 27 to 31.9. Again, those are pretty close to what reference ranges are. MCHC is going to be 32 to 36. typically the same as you're going to see with a lot of the reference ranges for labs. RDW is going to be less than 13. Platelets are going to be 150,000 to 450,000. Again, pretty close to your reference ranges for a lot of labs. MPV is going to be 7.5 to 11.5. Lymphocytes, here's where we get into a little bit of discrepancy. So the type of white blood cell. Lymphocytes, optimal levels, you're going to look for 24 to 39, neutrophils 40 to 60, monocytes less than 9, eosinophils 0 to 3, basophils 0 to 1. And those typically indicate, if they are elevated, the type of invader that's infecting. So is that going to be a bacteria, a virus, a parasite? Depending on which of those is there, those specific white blood cells are going to be elevated. Now, moving on to CMP, that stands for Comprehensive Metabolic Panel. This is going to be a test that your doctor is going to order if they're looking for something a little bit more specific. So pay attention to these ranges, because these are going to be very different than your reference ranges. These are going to be much tighter. If we're trying to optimize our health, we're going to try and zero in and be much more specific. Obviously, if we're trying to be optimal, we're going to want to really crush sort of the average, the general population, so to speak. So our GGT is going to be 0 to 30. Typically with a reference range is going to be 0 to 65. So you can see, what did we do there? We really tightened that up. LDH is going to be 140 to 215. AST is going to be 10 to 30. ALT is going to be 0 to 30. Alkaline phosphatase is going to be 70 to 105. Total bilirubin is going to be 0.1 to 1.2. Same with your reference ranges. Your bilirubin levels, again, these are going to be the same as your reference ranges. Albumin is going to be 4 to 4.8. Globulin is going to be 2.4 to 2.7. The albumin-globulin ratio is going to be 1.5 to 2.0. That's going to be a lot tighter. Our glucose levels, this is key. Your glucose is sort of the predictor of what's going on for the rest of your health. So if you are pre-diabetic, if you are not having stable glucose levels, you got to rein that in, because that is the foundation of, obviously people think of glucose, they think type 2 diabetes, they think obesity, maybe I'm not fitting in my jeans, I'm not quite as svelte as I was, in my younger years. But in reality, Alzheimer's is type 3 diabetes. So unless you are comfortable with putting yourself on a trajectory for brain damage, which is essentially what Alzheimer's is, then we got to rein in that sugar processing. So glucose, the reference range of your general lab is going to be 70 to 100. Your optimal levels are going to be 80 to 95. What did we do there? We tightened that up quite a bit. Your A1C is going to be 5 to 5.6. Your BUN is going to be 10 to 15. Again, your reference range on BUN is 6 to 24. Considerable difference there. And how's our liver processing? And our liver processing is huge. Are we getting rid of toxins? What are we adding to the system? What kind of overload are we experiencing? That's a very important level. Creatinine for women is going to be 0.49 to 1. Male is going to be 0.49 to 1.19. Again, those are probably going to be the same as your reference ranges for your labs. Your uric acid, again, these are pretty close. For women, 3 to 5.5. That's going to be much tighter. Men, we give you a little bit more leeway. 3.5 to 5.9. A little bit tighter than you're going to see on your reference ranges for most labs. Calcium is 9.4 to 10, potassium 4 to 4.5. Again, much tighter levels than the reference ranges for the majority of labs. Sodium 135 to 142, that one's pretty close. Phosphorus 3.4 to 4, chloride 100 to 106, CO2 is 26 to 31, and the anion gap is going to be 8 to 12. Again, we're tightening up the reference range for a lot of the labs that are out there. Our lipid panel, which is very, very important. What's going on with the fat in your cells? We talked about this a few videos ago. You may have a lipid panel run. They may tell you that cholesterol is fine. My recommendation is always have your particle size run, because your lipids can be fine, and if your particle size is tiny, that means that you have eensy-weensy particles and they're bouncing around in there and they're causing considerable damage. On the flip side of that, you may have elevated cholesterol, but your cholesterol is big like beach balls. And they're just like floating around, like, what did I say at the other video? Like they're like at a rave. They're being bounced around, like no big deal. Everybody's happy, no sweat. They can't cause a lot of damage because they're big. And that is less of a concern than if you had normal cholesterol, but your particle size is eensy-weensy like marbles. And they're in there and they're angry and they're bouncing around and they're causing a lot of damage and a lot of inflammation. So you want to make sure that no matter what is going on, you are having your particle size run when you are having a lipid panel completed. Cholesterol, optimal range is 150 to 220. And this is a number that a lot of people are familiar with. The reference range typically for a lot of labs is going to be 100 to 199. That's pretty big. So if we tamper that down and we're doing 150, and then you may notice 220 is higher. So again, we are less concerned about that number. We're more concerned about particle size. Triglycerides is going to be 70 to 100. HDL greater than 60. In a lot of labs, HDL greater than 39 is beneficial. We want it way up there. LDL less than 110 and CRP less than 1. That's going to be the same as a lot of your reference labs. Iron 50 to 100 and ferritin for women 20 to 110 and for males 30 to 190. Those are considerably tighter levels than you're going to see with a lot of your labs. Finally, one of my favorites, thyroid. Let's take a deep breath here. So, when a lot of my patients have a thyroid panel done, typically they have their TSH run, and their doctor makes their decision based on their TSH level. I'll tell you, that is a huge mistake. I am not an endocrinologist, but essentially what they're doing there is they're taking a picture of you like this. Okay, that's my TSH. Now, if that's the only information that you have of me, get where I'm going here, is that you probably could not determine my age, my sex, my race, if this is the only information that you had about me, was my eye, okay? That's essentially what your doctor is doing when they're taking your TSH level. If they're determining the health of your thyroid, they need to be looking at the whole picture here. Okay, they need to be looking at TSH, they need to be looking at T4, they need to be looking at T3, they need to be looking at your antibodies. They need the whole picture. So if you have a doctor that's not running a full panel, my recommendation, number one, is to suggest it to them. Tell them that you would like a full panel run, and again, I'll put a post up that lists everything you should ask for. If they contradict you or they tell you it's not necessary, my second recommendation is you need another doctor. Because you need to remember that those physicians work for you, you do not work for them. And your health needs to be the number one priority. And if they're not doing what you are requesting, you need to seek treatment elsewhere. So TSH, the generic reference range for TSH is 0.45 to 4.5. That is pretty big. My optimal recommendation for my patients is 1 to 2. Look at what I did there. That is tight. I want you healthy. I want you happy. I want you to be able to lose weight if that's what you're looking for. I want your brain working. I want you to remember. We tighten up those levels. Your total T4 is going to be 6 to 12.5, which again is a tighter range. Your free T4 is going to be 1 to 1.95. Your total T3 is going to be 80 to 190. And your free T3 is going to be 2.4 to 5.5. Please take a look at those antibodies. We don't want antibodies. We want those levels as low as possible. Those are very temperamental depending on diet. So if you eliminate gluten, those antibodies are going to drop like a stone. So my third maybe recommendation for your endocrinologist, if you have a doctor that tells you diet doesn't matter, you need to run. Like literally no joke right there. A handful of other levels. Vitamin D, this is huge right now. There are studies that are showing that the individuals that are succumbing the most to the virus that is circulating right now are those with the lowest vitamin D levels. Those with dark skin, they are not absorbing vitamin D like some of the rest of us. Reference range for vitamin D is 30 to 100. Okay, what is that? That's insane. If your level is 30, no, you're probably in bed. I don't even know how you're functioning. For my patients, I want it up there. I want you from like 60 to 80, 70 to 90 if we're really tightening stuff up. So please, please, I ran through those really, really quick. And again, labs are not necessarily like fun for a lot of people, but you should know if you're not feeling amazing and your doctor tells you that your labs look okay, again, please, please, the number one thing that we learn in functional medicine is to treat the patient, not the lab. So if you are symptomatic, if your energy is low, if you're having trouble losing weight, if you're not happy, if your brain is feeling foggy, if you're having trouble concentrating, any of those things, if your sex drive is low, you need to find another physician if they're not listening, or you need to just take your health in your own hands and step up, and let's make some really deliberate changes if we have some time right now. Again, if you're in Chicagoland, we got another month between us. So we got time to really fine tune what's going on. So again, if you're watching this live, let me know if you have some questions. We're kind of wrapping up here. If you're watching the replay, please post that as well. If anything comes up and you want to discuss privately, feel free to send me a message. And again, we have great specials going on right now. Feel free to send me your lab work. I will analyze the whole thing, let you know what it looks like, send you a game plan. We have incredibly reasonable rates right now. We're trying to help as many people as we can. Things have been nuts. If you haven't seen, we are also offering antibody testing for COVID-19. So we can ship those kits. If you're local to Libertyville, you can pick up a kit at our office, take it, have your blood drawn, and we'll have results in 2 to 3 days to see if you were exposed to the virus, if you've developed antibodies for the virus. So lots of fun things going on at North Shore Proactive Health. Great. We have another month to really fine tune our office before we fling open the doors again, before we welcome our massage therapists back. We are open for acute care right now, so if you are having headaches, back pain, if this stress has you all tangled up, let us know. We would love to be of assistance. And if you're not local to Libertyville, I have some incredible colleagues all around the country, actually all around the world, that would love to be of service during this time. So if we don't have any questions, I will wrap up. It is Thursday evening. I love you all. We were just told that we're in quarantine for another month. And you know what? We got this. So we will be together. I'm going to start doing some guest visits. So we are going to have, one of the number one stressors I found lately is financial. So we're going to have one of my very best friends, Sarah Samuels, come. She's going to do a chat on financial health. We are also going to have Annette do maybe a cooking class for us. She was our chef at our last women's retreat in October. It was incredible. It was vegetarian. I will tell you, the majority of women wouldn't have even known that we were eating vegetarian the entire weekend. It was out of this world. And we'll see what other fabulous guests I can drum up so that you guys aren't just listening to me every single evening. But if there are questions, let me know. If there are topics you want to discuss, please send me a private message and we will chat. Again, the majority of this is information that I find beneficial, that I use most routinely with my patients, and I hope that you find it of benefit as well. So take a look. We ran through all of the blood work really quickly. Take a look at your tests, print something out, listen on the replay to everything that I just went through and see where you fall. How many of your levels are off? If you have even one that's off, there's something that can be addressed there. So let's get on top of that. Let's get you healthier when you get out of here. So I love you all. Have a beautiful evening. Mwah! The weekend is here. I will see you tomorrow. Bye-bye.